Our app is based on two angles with one focus, giving the patient some autonomy. So the first angle is medical, where the doctor enters the protocol into the app, and then the app manages the patient's food intake, either by scanning the food, if you buy it from the supermarket, or by entering the food manually based on internationally recognized food lists that can be adapted by region or country. We manage also the patient's physical activity via Bluetooth device, if you have a connected watch, for example, or by entering it manually. We also manage the patient's glycemia level, linking to all glycemia tools available either Bluetooth or NFC, like Abbott, for example. And finally, based on the protocol and the three angles that I've mentioned, the three elements that I've just described, we calculate the exact amount of insulin that the patient needs to inject. This is revolutionary, and we are the only app with this capability on the market today, the only app. So the first angle was medical. The second angle is community. The doctor plays a major role as the supervisor. The patient needs to designate a caregiver. So we have created a diabetes community where people can share information around the disease and organize meetings if they wish so. The app also offers the possibility to do teleconsultation, teleobservance, and teleemergency. As doctors have access to data in real time, they can communicate with their patients and adjust treatment real time, even if the patient is not present in front of them. There is an SOS button available throughout the app, and if results are worrying or the patient feels unwell, then the SOS can be triggered. Our business model is based on subscription, monthly or yearly. We cover B2B needs. What we mean by B2B are all health professionals, hospitals, doctors, dietitians, sports clinics, sports professionals, any diabetes-related activity at a very reasonable price. For example, in Europe, B2B cost is 10 euros a month or 120 euros a year, and it will be similar in all regions of the world. We also cover B2C needs, as it's an application. People can just download it and buy them from Google or Apple Store. And for B2C, the cost in Europe is 25 euros a month or 250 euros a year, a little bit cheaper if you take over a year. In some parts of the world, this cost will be covered by private insurance for patients, and that's the case today in France. Again, we plan to have similar prices in all regions of the world. Our philosophy is to ensure patients do not spend too much money and have access to affordable and efficient care. So far, we have raised over 900,000 euros through bank loans and love money. Our development plans include our ongoing European launch, following by opening an office here in Dubai, and by the end of the year, opening an office in Canada, Montreal. We have committed to opening an office on 3 continents by the end of the year, and we will keep that promise. We currently have 10 letters of intent from university hospitals in France, as well as private clinics and private insurance companies. We've been in Dubai and Abu Dhabi for the past 2 weeks, and feedback is very encouraging from many hospitals. The app is an EU-certified Class 2B medical device. So Class 2B medical device, which we received last week. So it was perfect timing for us coming here and being able to announce that. We've built a scientific council with 3 professors from University of Bordeaux, University Hospital in Bordeaux, plus 4 doctors, including 1 pharmaceutical doctor. Going back to my associate's mother, she started to see a big difference in her disease after 3 weeks of using our app. Today, she has a hemoglobin glycated level of 6.4 when she used to be always between 8 and 9. Her doctor is amazed, as on top of it, she's over 80 years old. From over 30 diabetes-related incidents a month, she's now down between 0 and 3. So today we're here because, as I mentioned, we want to start our business in Dubai and in the Gulf.